Okay, everyone. I just wanted to go through some drip rate calculation with you. Some of the students I find that get a little bit confused with the drip rate. I just wanted to give you a bit of a context, clinical context, so you know why we're doing drip rate. So there are two different ways for us to administer IV fluid. So the first one is through the machine, and with the machine we put mils per an hour. And that's just the way for us to tell the rate of the fluid that's administered to the patient. Another way is just using the line without the machine, and in that way we use drops per minute. And why do we do drops? That's because there's no way for us to look at the fluid and just tell how much that is. So we can't look at the fluid and say, oh, that looks like 500 mils. So drops, we can count it and quantify it, and in a way we can objectively say, okay, this is 20 drops or 50 drops. So that's why we use drops per minute, because it's just that's the only way for us to tell how much fluid that's running. Why do we do minutes? Not like here. It has mils per hour. Here it has drops per minute. Why do we do a minute? Because we don't want to stand there for an hour and count the drops. So it's practical for us to just stand there and count 1 minute, how many drops gone through in 1 minute. It's just a way for us to tell the rate the fluid is running to the patient. So that's the context. Some students get a bit confused with the drop factor, and they don't understand why we do times 20 or 60. The drop factor, it differs depending on what line we use when we count the drop per minute. So that only means, different lines got different filters, and microfilters divide 1 mil into 60 drops. So it just means that micro giving set divide 1 mil into 60 drops. This particular line has a filter that divide 1 mil into 60 drops. Same thing. So macro giving set, it has a filter that divide 1 mil into 20 drops. So it's got 20 drops per mil, and that's what we call standard giving set. So in clinical settings, you'll usually only see those two, micro and macro. In exam, the question may give you a random drop factor like 15 or 40, so that's depending on the question. But in clinical setting, you usually see these two different lines, and usually we use the standard drip. That's the standard line. So that's the context and why we calculate the drop rate. So we can use either machine, or we can use the normal line. If it's machine, we can just put mils per hour. If we use just a normal line without machine, then we need to do drops per minute, because that's the only way we can quantify the volume that's infused. And we do per minute because we just want to stand there for 1 minute, that's all. So that's the clinical context of the drip rate.